Wes Streeting makes me think of a really hungover bloke who passed out drunk the night before only to wake up and remember what he actually said. But instead of having the fear in the pit of his stomach, I think the health secretary really does believe what he says. Sadly for the country, what he says increasingly makes me think he doesn't understand anything about healthcare. Instead of doing any work to fix issues in the NHS, he seems more content with grabbing headlines while alienating medics who are key to the country's health. He should be focused on ensuring funds are available to repair dilapidated hospitals and have a proper plan to tackle waiting lists. Instead, he has seen fit to open his mouth and, in a recent interview, proclaimed that the minority of GP practices are coasting at the expense of those who are striving hard. I would never say that all GP surgeries are perfect, with the frustration of not being able to secure an appointment after calling up bang on 8 a.m. a bugbear across the UK, but I would say it seems Wes Streeting has no knowledge of just how hard doctors work. It appears that, like many people, he thinks that if they don't have a patient in front of them, they aren't working. Does he think being a doctor is the medical version of working on the tills at Sainsbury's? It definitely seems like he does, which is deeply worrying for someone who is supposed to be in charge of the nation's healthcare. While Wes will be aware that most GPs have surgeries in the morning and then in the afternoon, he doesn't seem to realize that in the gap, they are doing everything they can to keep their patients alive. I recently attended an inquest that followed a similar pattern to almost every one I've been to in my almost 20 years as a journalist. The evidence revealed how the GP had tried everything she could to get mental health support for her patient, but the services that could help let him and her down. And, while the government talks about reducing waiting lists, Wes and his left-wing chums need to realize there are thousands of people out there who are in a similar position to one I was in a few years ago. Back then, I was told I was too ill for one service and not ill enough for another. Without the support of my GP, I would have fallen through the gaps. If Wes Streeting is serious about his proposals, announced last autumn, to shift the focus of healthcare from hospital to the community, then he needs to understand what GPs actually do. As a cancer patient myself, I appreciate that I have had a lot more exposure than most of the inner workings of our NHS, but Mr. Streeting really must get a grip of the issues it faces. He needs to focus on ensuring there aren't any gaps in the NHS so GPs don't have to spend their time covering for services that aren't there. In his interview with Health Service Journal there is a hint he recognizes that some GPs are working really long hours. He says he is concerned that some are toiling away at 1 or 2 in the morning. This is a concern of mine too. In my pre-cancer days, when I used to drink alcohol, I'd occasionally walk past my doctors on the way to buy lagers from the corner shop. More often than not there would be a light on in one of the GP's rooms as they tried to finish everything. Surely it is the health secretary's job to solve this issue. Part of the solution is to stop hospital doctors from giving GPs homework, like instructing them to book tests or prescribe medication that they could have and should have done themselves. The other part is for GP surgeries to be given the funding and staff they need to support all their patients while also allowing them to go home to their families at a reasonable hour. I'm sure there are lots of GPs who would be happy for him to shadow them for the day so he can learn that, instead of incendiary headlines, GP practices need his support from him so they can be the best they can be. Here is a summary of internet users' reactions. I'm extremely lucky I have a good health center. Whenever I have telephoned for an appointment I have got in the same day, sometimes within the hour. I think many abuse the GP going for ailments that a pharmacist can help with, taking valuable time up. My 90-year-old mother has just been admitted to hospital after a fall. Had I known how she would be treated I would never have let her go in. She was given no bedding, food or water until I got there the day after she was taken to A&E. I do not live local to her. The ward is dirty. Blooded plasters left lying around. No one answers a phone so they just ring continually. In the good old days of a matron this would never have happened. I wonder how often the manager of the hospital walks around to see how things are really on the wards, or do they just sit in an ivory tower counting their money? Wes needs to get a grip, and soon, or there will be no staff and no NHS for him to control. Sir Two Tears says that the NHS must reform or die? I wonder if he was implying die under Dr. Wes or reform under Farage. Just like the rest of his front bench colleagues, Dr. Wes will never fix the NHS if all he has got is to continually blame others within the organisation for the predicament he is in. He probably believes that if he fails then it won't be his fault. Just out of curiosity, has Angie the builder completed her first 150,000 new homes in line with her promised target, and has Energy Ed Milliamp started reducing consumer energy costs yet? At this rate the NHS will collapse, not enough homes to house the current population let alone newcomers, and power outages similar to the 1970s. On a positive note, we might be able to do our bit for the green economy by ziplining between towns if Energy adds green electricity pile-on policy fails. Sometimes things aren't fixable. You just have to make a new one. Just use the £350 million per week for the NHS. It was actually more than that. Theresa May actually admitted they received more. They have, and some. Maybe he should spend a few days walking in their shoes before pontificating in soundbites. No chance. The problem is that the people being put in charge of various departments, not just health, are clueless and have zero knowledge on the subject and don't know how to run a department like health. Wes Streeting comes across as a child wearing a suit. Wes Streeting has been out of his depth since day one. Even in opposition he was out of his depth. Funny he was never off the TV when in opposition, constantly trying to score points and saying he has a plan for the NHS. Since gaining in power he like Miliband is rarely seen, and where is his plan? Another rabbit ate and the headlights running scared. Streeting needs surgery, but still has no idea where to go. Streeting has no idea, period. Stop worldwide healthcare. Only those born in the UK or who have paid taxes for at least 5 years should be entitled to free healthcare. Starmer, do your job and stop the biggest health scam before you dare say the NHS doesn't work. The NHS appears to be totally unfixable due to population numbers increasing month on month, while staffing levels falling due to pressures put upon them without recruitments in place. It's fixable if we had politicians who intended to do it instead of selling it off and giving it away to the world. According to Streeting words, he has to have a community member standing in front of him or he's not working. It's the same status he has made on doctors. No plan for social care by 2028. Nothing will be fixed. Only using private services to reduce waiting lists equals higher costs. No worries. Most GP surgeries in London are owned by American companies. Labour will no doubt sell off the NHS to the same buyers. The last Labour government was responsible for the massive increase in private companies winning NHS contracts. I used to work for Care UK and they made pound millions out of the NHS under Blair. Labour supports are in denial. Is he actually a male? He doesn't look like it. Maybe he fits Starmer's definitions though? None of them have the backbone to do what needs doing. They are all admin people who will always save the admin people and tinker with things they think won't upset the admin people rather than taking the bull by the horns and doing it right. Don't worry, with a good number of London surgeries now owned by American companies, no doubt Labour will sell off the NHS completely. Our health is of no concern to Labour. So if that's the case, what's he getting paid for and still in the cabinet? Heaven help us, another fish out of water. Streeting, like all Labour ministers, are out of their depth. All we get are sound bites. We're gonna do this, we're gonna do that, or we're setting up a task force, or investigation. It's all bluff. If they spent the money they are spending on investigations on the NHS instead, that would be a lot more useful. In most cases we don't need investigations. We all know what is wrong. The Labour Party. My 90-year-old mother has just been admitted to hospital after a fall. Had I known how she would be treated, I would never have let her go in. She was given no bedding, food or water until I got there the day after she was taken to A&E. I do not live local to her. The ward is dirty. Blooded plasters left lying around. No one answers a phone, so they just ring continually. In the good old days of a matron this would never have happened. I wonder how often the manager of the hospital walks around to see how things are really on the wards, or do they just sit in an ivory tower counting their money? Wes needs to get a grip, and soon, or there will be no staff and no NHS for him to control.